Good evening. And since few days we are talking in India about Russia, and we are talking that Russia is having very less number of deaths by coronavirus as compared to the sheer number of patients. Russia is having more than 250,000 patients at now, but fewer than 2,500 deaths. That counts around less than 1%, to be exact 0.9% of total cases are fatalities. So why it is so, and what is the reason behind so many numbers but so few deaths? I'm having a senior journalist from Moscow, Miss Ingrid Kim. Welcome, Miss Ingrid Kim.
Hello, Dr. Gurles. Nice to take part in your interview. I would like to reply, first of all, maybe we use in May recently from our government. I know that it was bought a lot of Vipiravir produced in Japan. This medicine, first of all, it's helped to treat COVID. And also, I hope we are get good immune system from our childhood. We're making this injection, anti-BCG, tuberculosis.
Okay, you guys get BCG, huh? In
Yes,
childhood.
yes. As I heard, in Portugal, also low level of disease of infected people, and maybe the same statistic similar to us. That's why we have this good statistic, a low level of our infected people, dead people from coronavirus, and it's helped us to resist. The immune system we are living in, we enter very cold every year. Maybe temperature also influence for our health, because in December last year was below 3 degrees, and after it will be down, temperature will be colder in January. Maybe that's why it causes this problem. It start to be more increasing this problem. In March it will be starting pandemic here in Russia.
Okay, let me join few dots. As you were telling that you guys have got that BCG vaccines, and similar is the condition in Portugal, even in India. We all have got the BCG vaccines in our childhood. So it may be a reason that why these countries, that is South Asian countries, India, all the South Asian neighbors, Russia and Portugal, as you were quoting about Portugal, because Spain is suffering very badly. But that is not the condition with Portugal. So it might be a reason that you are quoting that BCG, and even in India, there were talks, there are still talks that it may be a reason that BCG is protecting us, giving us some immunity. But all things are still, data is being collected. This virus is still new for medical practitioners as well as the scientific community. Ms. Ingrid, you were telling me about some Japanese drug. It is favipiravir.
Yes, I know that Kirill Andreev, our Russian government health department representative, said that they bought this medicine from Japan, and favipiravir is being used to treat COVID-19 very effectively, and I think a government use it now only for a hospital, because we cannot buy it retail. But anyway, it needs this medicine only when you got this coronavirus, and to fight this disease you need to accept it, to take it, to treat yourself. I think it will be produced also, because we use in Russia medical formula of this medicine, in this will be produced in Russia too. I think so. Analogical medicine. We are hoping to get it soon.
Actually, even in India, there is a very good pharmacological brand called Glenmark, and Glenmark has started testing on 150 patients in 10 hospitals, both private as well as government hospitals, the same drug, what you are quoting. So let's hope for the best. If this drug is working, maybe it has worked in Russia, so it should also work in India. Let's hope for the best. Let the results come. And fortunately, since you guys are using it before we started researching upon it, collecting data on patients, we might have ample amount of data, because after United States of America, Russia is the second largest country to have most number of cases, just after US, but very few deaths. So I think when we talk about this drug in particular, this Japanese medicine, we will get sufficient ample amount of data from both your country as well as from my country. So it may be a cause, but remarkably, the numbers are very few, the percentage-wise. Like your Western neighbors, I'm quoting Spain, France, and Portugal. They are having a death percentage of 12 to 14%. You're even more closer to you, Germany. Germany is having 4.4%. But why is Russia having just 0.9% of casualties? Are the numbers correct? To us, you, but
Yeah. The
some
numbers
people
are
are doubting.
correct.
Some people are doubting.
Yeah, we have
Some
official
people are
statistics.
saying that maybe the numbers are not correct.
No, the data which we are represent officially for international use is correct, and every day, especially Moscow has the more disease infected people, the more cities among our Russian cities, the most in first place is Moscow after going St. Petersburg or different regions of Russia. And we are fighting this coronavirus every day, and we have many volunteers, all hospitals, or I told you the equipments which is imported from Europe. We are using in Russia ventilators a lot. We have a lot of doctors in good qualification which appreciate our medicine here. We are fighting every day, and people follow rules sitting at home. This is very important,
Okay.
wearing mask and gloves, because we have our self-control. We understand that this is our responsibility, first of all. If we are not follow rules, we can get this disease very easily. So that's why we're sitting home, is self-isolation. It will be last till 31st May, as our president said. And our president supported our families who have children. We got around $200 for each children payment from government. This is very give us very good hope and support this difficult time. Otherwise, we're sitting with our job on waiting our what will be in future, waiting
But
improvements.
Ingrid, sorry for interruption. Are the
Yes.
numbers correct? The death numbers
Yes.
of
Yes.
0.9%.
Yes, it's correct, because we have people who treat already with disease fighting. I have friends who already was before ill by coronavirus affected
Okay.
and is staying 1 week at hospital and come back to home. We have some after we have oxygen nutrition, with problems. If you have a study, you have hard stadium phase of the disease, or you wear it just mediums, like it's not was so hard for you. If you are, for example, age from 25 till 35 or 40, you resist to this disease not so it's like a flu. It's like a flu,
Yeah.
will be big temperature and cough, and that's it. So they are recovered now, and they have a special collective immunity, which we are this waiting critical mass of immunity, so we can get this plateau. That's why we have a statistic that it's usually the pensioners, the under 65 years old, who cannot fight. It's very hard for them because they're
For
already
old
old.
people.
Old
Yes, old
people
people,
more,
the immunity is down.
or maybe some people who had chronic disease. To be honest, it's
Okay.
regulating, but they cannot fight because immune system low. My doctor said, friend, it depends on your immune system individually,
Hmm.
especially this tricky coronavirus, which
Individually.
just has this formula. It mutated. Some scientists said it's mutated. Even it started in China. One, for example, yes, you mean maintenance of these bodies inside of this virus, but when it's going for Europe and Russia spread it, it's changed their special. Where inside what they have is maintenance of their formula. It's especially changed for upon the climate, upon the country. You see in, for example, in Russia, it's not so many deaths, but it could be suffer Iraq or Iran. But it
Oh
depends
my
where
God.
where where we'll
They are
stay.
having mass graves, mass graves.
Yeah,
in Iran.
my condolence to all people who have lost their relatives. And I mean, it's not a joke. Of course, nowadays we are suffer all, but even we are expecting when it finished, we don't know, but we are hope it will be finished till. I know your quarantine finished tomorrow. In India, we are congratulate you with special day of starting the
But
normal life.
my city is under red zone. My city is under red zone, so we have to stay in.
You have to stay. Oh, your city, Uttar Pradesh, but the great
Madhya
city.
Pradesh is Ujjain. See, Madhya Pradesh also almost you can say 60% is cured of. You're not cured, but it is corona free. But 30 to 40% towns still they are having corona. So those towns who are still having corona, suffering with corona, they have to stay in.
So
Miss
you
Kim,
will be waiting. Mhm.
apart from medical, yeah, I got some news. Is it true that Russians are also developing some special clothing to fight coronavirus?
What, you mean vaccine?
Cloth.
Ah, chlorine. Yes. I understand. We're using our special because even space starting from Soviet time, we're using this material. It's special one, resistible for virus. I even know the doctor's special detail cannot go to toilet, uh, take off, their pains because you need to wear like a pampers, like a child when you have your
Mhm.
regime work. Yes, because it's very dangerous for doctors.
No,
We are
so those clothing is for common people or for is it like a general cloth or
no, for
for,
specific use. We cannot buy it. If you want to buy it, we need to order from Amazon, America, or
okay,
European.
that is like PPE kits. PPE kits, what we call personal protection
Yes,
kits.
like a
Okay.
kits. Yes, you're right. Medical kits. Yes.
No, that means I must have got some wrong news that they are developing some special clothing because a lot of news circulates on social media. I must have got something wrong. So that's the reason I confirmed
No.
with you.
We produce it for doctors, for this personnel who are working in this area. I mean, the red zone where is coronavirus. I mean, hospital or special zone where is incubators, where is
Okay.
affected
Yeah,
people.
yeah, I got it. It's PPE kits.
Yeah.
Uh,
And
Miss,
also, I want to add with all businessmen who do social business, where, for example, has hotels, has some special exhibition zones. They give it to government for rebuild to renovate for hospital this time
okay.
because we have a lot of you see statistic affected people still. We need to stay them isolated, so it must have space. So our businessmen support government and gave special buildings which was equipped by medical equipment and doctors occupied by infected patients, and we still hope it help to fight with this pandemic to finish soon, as soon as possible.
Okay, Mr. Putin said that from Monday onwards, it will be depending upon the governors of states to impose the lockdown or to open it. So supposedly, your town is open. You are in Moscow. I don't feel that Moscow they will opening. They will be
No,
opening.
it's not open. Moscow, it's gives a special, a first, like in music, first tone of mood.
Okay.
We are sitting, I told you, till 31st May, officially, our quarantine, and we still don't know it will be finished this date, or maybe it will be last again in June, but we are pray that it will be finished in the end of May.
We also wish that for you.
Thank you very much, Mr. Gures. I'm always feel support of India because India and Russia is a long term of
We are
diplomatic
friends.
relations.
We are friends.
We're we're good friends. I like
You are a
India and I
special
know
friend.
our tourists going every time, every year. Special
Uh,
India cities.
Miss Ingrid, I just want to ask you if suppose are there any fines on the people who won't be wearing masks or who won't be following social distancing on those places where the
Mhm.
lockdown will open?
Yeah, it's a responsibility, as I mentioned before, for individual. Your answer to, I want to say, it's police can make a fine if you see in, for example, shop you cannot enter without mask and gloves. Your individual,
Okay.
which is you can usually buy very easily in the pharmacy. It's very available,
Yeah.
all and any place.
And
It's
what
a
is the
fine,
fine?
like around $60 as I
$60. It's too much.
Yes. Yeah, but
It's a heavy
you
fine.
know, yeah, I mean, it's very right decision for our government to motivate people to be very responsible in this special time,
Yes,
because we
that's
have
good.
quarantine with, yeah. So I follow, if I go to, as a journalist for my work, rail station, or I go subway, or I go shop, even I go hospital, or even I some a public place in the street, we're wearing this. We must follow rules. It's very important for you need to prevent this problem. Hygienic, even in train, I follow when I travel to St. Petersburg, we have separate places from each other and wearing mask, and each hour cleaning this spot, our place, by this personal steward. And also, for example, temperature was taken by with special when they measure my temperature.
Yes,
By yes, by
electronically.
for prophylactic, electronical, yes, Teploweiser.
Yeah. And what is the condition of economy?
Condition of economy still it's a recession nowadays because the restaurants closed, all shops closed, the rent is go down and prices was down. We will hope to recover after the quarantine finish to back our work and continue to go strike with this problem, economical crisis, which is cross with all the world. I think in your country also, because all flights close, all
Yes.
trade is stopped, and even oil, this crude oil is go down. This Brent price is stepping down, but
Yeah,
we
Brent
hope.
prices are too
Yeah,
low.
yeah. Who knows? We will hope to be recover, because we have our collective desire to work and to continue.
Miss Ingrid, we wish you best of for your country to come out of
Thank
this
you.
COVID-19 problem. And we also request you to take care of yourself, because as a journalist, you have to go out. You are taking photographs, you are posting them on in newspapers, social media, everywhere. And I'm seeing that you are posting constantly the photographs. So you must be going out. So please take care of yourself. Observe social distancing, use mask.
Thank you very much, Ms.Ingrid. Thank you. I follow your advice. I
Okay, thank you for
appreciate
joining
your
us.
support. Thank you.
Good
Bye.
evening. Bye bye.
Bye. Thank you.